Good morning, Kalispell. I hope you're all doing fantastic. Oh, my webcam is being a little goofy here. Give it a hot minute so it can try to focus. There we go. That's a little bit better. So, this morning we are going to go over some more great information on hbot or hyperbaric oxygen therapy and strokes. So, strokes, I don't know many people that I run into that don't have a family member or know someone that has been affected by strokes. So, strokes are the fourth leading cause of death in the United States, and it's remained a leading cause of adult disability with around 800,000 cases reported every year. Hyperbaric oxygen therapy has been shown to help prevent and treat people post stroke through a number of different mechanisms or mechanisms of actions, depending on who you talk to. Hyperbaric oxygen therapy can be used to precondition the brain by producing more circulatory pathways within the brain itself to potentially decrease the chances of strokes. Also, this has been shown in scans post stroke to benefit people as compromised blood flow to the affected areas of the brain and its functionality are recoverable by introducing increased levels of oxygen. And the damaged area of a brain is called a penumbra, especially when talking about strokes. So, studies have demonstrated the benefits of hbot for stroke with the following. So, prevention wise, it can help stimulate the creation of new blood vessels, new circulatory pathways. It helps decrease oxidative stress on the brain. It helps promote optimal blood flow to and within the brain. And it preconditions the brain to enable neuroprotective properties. Post stroke with hbot, here's some of the things that have been noted: faster overall recovery, reduction in paralysis, increases brain tissue recovery, promotes the creation of new brain cells. Repeat that one: promotes the creation of new brain cells, helps alleviate spasticity. So, a lot of times, people will go in and have Botox done to help reduce the rigidity because of the spasticity that happens post stroke. It helps improve vision and speech. It accelerates gross and fine motor skill recovery. Pretty cool, especially learning, try to, or relearning how to eat, feed oneself, or trying to walk again, becoming ambulatory. It helps stimulate the creation of blood vessels to reclaim damaged brain tissue. That would be within that number. And it escalates the creation of new brain connections. So, a study found in the International Hyperbaric Association, neurological function was improved in post stroke patients with hbot. This is from January 2013. A prospective randomized clinical trial focused on the introduction of hbot to post stroke patients. There were a total of 59 participants who had suffered a stroke 6 months to 36 months prior to the inclusion and had at least one motor dysfunction. They were randomly assigned and treated, and there were crossover groups. The treated group received 2 months of 40 treatments, which consisted of 1 hour sessions 5 days a week. So, once a day for 8 weeks, um, and taking the weekends off. Whereas the crossover group was evaluated after 1 month with no hyperbaric oxygen therapy, and again after 1 month following hyperbaric oxygen therapy, utilizing the same treatment protocol. So, once a day, 5 days a week. So, they would have got 20. The evaluating physicians found that neurological function, brain activity, quality of life in all patients improved after hyperbaric oxygen therapy. Brain scan results directly correlated with the clinical improvements and indicated that hbot can lead to significant neurological improvements in post-stroke patients, even at chronic late stages. That is pretty awesome. That is a gleaming light at the end of the tunnel for many, many people. The observed clinical improvements indicated that new brain connections can be activated long after a stroke occurs. That is pretty darn cool. So, if you guys and gals have any questions or comments, please drop them in the video below and we will answer them as soon as we see them. Have a great day, Kalispell. See ya.